There we go. Okay. So we're going to talk today about supported employment / individual placement and supports. And there is a slight difference, and I'll kind of explain it to you, but just know that I will probably use supported employment and IPS kind of interchangeably because most people do. So if you've ever heard of OOD or Opportunities for Ohioans with Disability or Bureau of Vocational Rehab or BVR or VR or vocational rehab, that is sort of under the traditional approach to kind of job searching. What I do is I'm an employment specialist, and I always tell people the easiest way to think of it is I help people find and keep jobs. It just kind of covers everything. Traditional VR or voc rehab took the approach of let's focus on getting someone ready for a job search. Let's make sure that they're connected to services. Let's make sure that they're showing up consistently. Let's make sure that they're medication compliant, that they haven't had, symptoms in X amount of months or whatever it is, or they haven't been in the hospital. Like, there were a handful of things that everybody said, okay, let's kind of go through all of these pieces. And then when the person is ready to work, then let's have them do this. Supported employment is almost the complete opposite. It is taking it from a standpoint, if someone says, hey, I'm ready to work, then we go, okay, let's figure out how to make it happen. It's part of recovery. And that's the big kind of paradigm shift. One of the things I was telling them that I read a bunch of articles and did a bunch of research and looked at a bunch of studies. I will not spend all of our time looking at that, but there are a ton of resources that when Jamie sends it out, you'll have a bunch of references listed. One of the things I love that I read was that they said there is expert opinion and then there is evidence-based practice. And those are not always the same thing. So when people were looking at voc rehab, they were coming from a very good place, but individual placement and services, or IPS, is actually the evidence-based practice under supported employment. And one of the things to know too is that supported employment is kind of an umbrella term, and then individual placement services is the evidence-based practice within that. So kind of like if we talked about a cardiologist is always a doctor, but not every doctor is a cardiologist. It's kind of the same thing. You might hear supported employment and they might not be talking about an evidence-based practice. And I was trying to think about, with the audience that we have, what do I want you guys to get out of it? And the first thing, honestly, is I would like for you to have kind of a general understanding of it. And hopefully you go through, and I would love if you sat down in your integrated care team meetings and you said, hey, we need an employment person here because it's really important. That would be the goal. The second part of it is I want you to look at it, if you do start reading into it or if you do start hearing about it, that you want to make sure that it's the evidence-based piece of it so that you're actually getting the results out of it for the clients that we're working with. So, okay, a little bit of background. So IPS is primarily used for people with severe and persistent mental illness, typically schizophrenia or bipolar, but it was created in 1993 by Dr. Becker and Dr. Drake. They're two huge names within the field. If you read any research and their names are not mentioned, or Dr. Bond, I would kind of question it because they're sort of the Beatles of supported employment, if you will. They're also looking at it outside of just mental health. So there's a whole list here of people dealing with substance use disorders, autism spectrum, intellectual disabilities, involvement in the criminal justice system, the first episode, psychosis, transition-age youth, and more common mental disorders. Basically, they're finding that since they created this program, it's working for people with mental illness, and they're going, we think it's going to work for other people as well. And they're starting to see the research of that. They're even also doing studies, as currently as like 2021, this year, a couple months ago, where they were kind of looking at how can this help people in rural communities. And we've talked about that too, where we talked about the issues with transportation and availability of employment and kind of everybody in the same community and that kind of stuff. So I thought that was kind of interesting. Now, there are some things. I do love evidence-based practice. I do love data, some of the nerdy heart that I have. I will share some of that with you. But one of the big things to know is that typically with this program, we are able to help people get into jobs, and IPS has been proven that people stay in those jobs longer. And having a job and having consistent long-term employment tends to be better for people's mental health. So there was a Hoffman study where they compared it with kind of their quote unquote usual job searching methods with IPS, and the job tenure was triple compared to the usual services. That's huge. That really is. So, and it was looking at over the course, there was one study that looked at 2, and then there was one study that looked at 5 years as well. So it was long term. We also have research that says that people who are vocationally active in the FEP or the first episode psychosis teams, if they are vocationally active, this doesn't mean that they have a job for 12 months total. It just means that they're active in the vocational side of the program. They're more likely to continue with treatment after a year, which is huge too. Also, we have people normally have a reduced use of mental health services, especially psychiatric hospitalizations. And one of the studies that I read said that you kind of look at that and it's over $500 over the course of 6 months that gets saved if someone doesn't go into the hospital. And that's just looking at the money side of it. That's not even talking about the impact of someone going into the hospital on every aspect of their life. And then IPS groups, just clients that have worked and then people that have been involved with the studies talk about their self-esteem increasing, being able to manage psychosis symptoms better, and just general quality of life and life satisfaction. That's pretty big too. And there are just, like I said, from the inception in the 90s until now, there are just continual studies talking about how this program is effective, how the evidence-based practice is better than just saying, oh, I can help you with a resume and help you with some interview skills. So all that to be said, these are the 8 principles of IPS. And you might be a little bit familiar with this if you've typically, one of the things that people do in the office is they'll have a sign hanging up, they'll try to talk about it. One of the things I want you to know though, is that when you have an employment specialist on your team like me, this is part of what we should be doing. And so when you're kind of looking at how do I integrate, how do I help, what do I do? I think it's helpful to kind of know the base that we're coming from. So the first thing is that it is 0 exclusion, 0. That means, like we said before, if someone says, hey, I want to work, that means we start them on that process. It doesn't mean, oh, well, you have to work out, you know, this part, and you have to look at this, and you have to do these things. We figure it out. So if somebody wants to work, that means they're ready. They don't have to jump through hoops. They don't have to go through any prerequisites or anything like that. A couple studies had kind of the same information where they said more than 60%, the number is like 63, 64%, depending on the study you read, that people with mental illnesses express that they want to work. Less than 20% are actually employed though. And then depending on the study, 2 to 5% of people actually have access to effective employment services. Because you have to figure that it's an overwhelming process. Anybody ever looked for a job and felt totally overwhelmed? Anybody ever said, oh my goodness, I need to update my resume. I don't even know where to start. Imagine if you don't have any work history, or imagine if you haven't worked in years, or if you were in the hospital and you were sick and now you're like, I kind of want to go back, but I don't know what I'm going to do. 2 to 5% of people have access to people like me. And so that's part of what we're trying to change as well, to make this commonplace and to make it a resource that everybody has. The second principle is the integrated employment and team treatment team. So this is kind of what we talked about. Like when you talk about integrated care, this is the big part here. Employment specialists, they can go by different titles. That's me. We're embedded in mental health services, meaning we work at the agencies that we're in. We're part of it. We have a desk there, whether we're there or not, might be another thing, but we have connections to the agencies. We're available by phone, available by email. We regularly attend treatment team meetings. So if the meeting is every week, we should be there every week, or whatever the frequency is that you have. We work closely with psychiatrists, the doctors, the counselors, the case managers, anybody else that's on the team. And we've had the discussion in here where we've talked about how I am typically meeting with the clients probably once a week. We either do on the phone, we do Teams, we do in person. I also text my clients back and forth. We talk about some different things. And one of the things that you notice being an employment specialist is that people don't necessarily connect us right away with our mental health. And so we'll start having a conversation about something and it'll open that door to say, whoa, this person started talking about this subject. I think the counselor needs to know, or hey, I think the psychiatrist needs to know. And that's the value right there, I think, because we are all coming from different directions. And kind of like that last point on the slide, where we openly discuss and find solutions for issues that might impact employment and recovery. So we're all coming from different directions and hearing different things. How do we combine forces to make the best choice? So third principle, competitive jobs. So if you've ever looked at, there's been like, sometimes you'll hear about work trials. People will say, oh, this person could work for 6 months and then this job ends and then we bring in somebody else. That's not what we're talking about here. We're talking about if you go on Indeed, if you go on any of the job search websites, these are jobs anybody in the community could apply for. They can be full-time, they can be part-time. The pay should be the same. It's going to be at least minimum wage because it's a competitive job. There are conversations, like if you talk to people from APSE, and I forget the official name for that group, but that's part of it, that there are certain jobs where people with disabilities are paid sub-minimum wage, and that's a big conversation legally that we won't get into. This is long-term employment. Ideally, this is something that someone could be in for a while. And then reasonable accommodations could apply. So we have kind of an activity. So if I'm your boss and I say, okay, it's your first week of work, I have a work assignment for you. All right. Okay, so read over this and then get back to me later. Can anybody read that? Probably not. If you have better eyesight than I do, maybe. All right, so we say, okay, reasonable accommodations, we'll make it a little bit bigger. Okay. All right, so read that and get back to me later, right? Yeah, I can see some of you like, wait a minute, what? Then I go, oh, fine, everybody else can read it. Okay, we'll change it. And if I change the color, it makes it a little easier, right? So reasonable accommodations are protected under the Americans with Disability Act, or the ADA. Now, they are based on a medical condition. So like in our example before, your eyesight, based on like what we had, just our kind of standard stuff at our job, you couldn't read it. And so you were unable to perform the job duty because you couldn't read it because of your eyesight. Now, the second part to that, the reasonable accommodation is to help me as a client come in and we can change something small based on my medical condition, right? The second part of the ADA, though, is it should not cause undue hardship for the employer. So making print bigger, making a different color, that seems reasonable. But if I said, oh, I just don't like to read off of computers, can you print out everything for me that I'm going to use? That might cause undue hardship. Or if I say, well, like the case that actually led to this was a guy that he was a cargo holder at American Airways in 2002, and he hurt his back, so they moved him into the mailroom. And then he said, well, my reasonable accommodation, because I have this back injury, is I want to be in the mailroom. And he kind of wanted to slide into it without having to do the competitive piece of it where everybody would apply for it. And so American Airways went kind of to the courts and they said, hey, we have to allow other people to be able to apply for this as well. We can't just let him go into this. And so that's, when I say that, it's because it's looking at it from the client perspective to say, what small changes do we need to make so that you can do this job? But then also we're working with the business. What do they need to do and how do they need to function? Which leads me into systematic job development. So part of what I do is I go out and I talk to employers. COVID has changed that a little bit. So now it's a lot of phone calls, there's text messages, there's emails, that kind of thing. But it's basically getting to know employers. And it isn't always going, you're going to hire my person, because that doesn't work for anybody. It's more, tell me about your business. Talk to me about what are some issues that you've had in the past that you're looking to avoid. What do you really need from people? What, shifts do you have? What could we do? And getting a feel for, will it be a good match between the employer and the employee? That's the big thing. And so if I do need to ask for a reasonable accommodation for somebody that I'm working with, I need to know what the environment is in the business to see, is this a good fit for everybody? And this is something reasonable. There have also been studies where they talk about reasonable accommodations, yes, but good supervision is also huge too. And that's something when I'm talking to an employer, I'm trying to gauge too, to see how supportive of an environment is it, what are the coworkers like, what is the culture, and kind of getting a feel for all that. There's also a piece called disclosure that you'll hear multiple times, and my clients should hear multiple times. So your medical information is on a need-to-know basis, right? Now, disclosure basically means the clients get to choose how we share that. I always say medical information is on a need-to-know basis, and very rarely does your employer need to know that. And so we talk about it, and I always tell them, if I have to have a conversation about something medical, I'm going to have the conversation first with my client to make sure they're on board, and then I'll have that conversation. Because if you put yourself in that person's shoes, imagine if I said, oh yeah, Nicole, I shared your medical information. Hopefully you're okay with that. You'd be like, what? And I think any of us would be. And so that's part of disclosure. It also means that the person gets to choose. Like I always tell people, I'm going to put you in the best light when I go in to talk to an employer. But if they say, you know what, please don't mention my name, I won't. Or if they say, hey, with this company, you can share my resume, you can say everything you want about me, but this one, I'd prefer you didn't. Okay, we can do that. It's up to the person to choose. All right, so this part kind of sounds a little bit like traditional VR. They have something called job coaching, which you guys might have heard of before, and this is a very similar idea. But it means time unlimited supports, and that's where the difference is, where typically traditional VR is like 90 days, everything's successful, and we move on and we close the books. With supported employment, this is we provide supports in whatever way makes sense for as long as the person wants. This could be on the job where I've gone to work with people for their first day or two and I've kind of helped get them acclimated. It can be, hey, I know that your phone's going to be off, but could I text you when I'm on second shift just so I know that someone will hear it eventually? Or, hey, can we continue our conversations? I've worked with some people for almost 3 years now, which kind of leads us into that last point where I have one lady, she started out part-time, she went full-time, she just bought her first house. All this great stuff that it's just touching base to say, hey, what do you need? Are you okay? I also have people too where we talk about, I have a guy that we're going to quote unquote have him graduate in November. And that's part of the conversation is say, hey, you're getting ready. We're going to close out your case successfully. Do you need anything? Do you have any questions? Can I give you any support, for you to be able to graduate? So it just depends on what the person needs. And having that conversation with them as you go along. And then this is, if we could highlight, star, underline, italics, all that stuff, individual preferences. This is the heart of the whole thing. This is what does the person want to do, including in their job search, what they disclose, how much ongoing support they get. I think we've talked about where I have a rule with my people that I say, you can say no to anything, but you have to tell me why. Because I can't assume I know, because if I assume, and I always use the example, if I give you 25 job leads and you hate them because they're the color green, if I don't know, the next 5 are going to be lime green and we're just going to be frustrated. And so I always ask, because when you assume, you become an assumer. We'll keep it, PG, but that's the kind of thing where it's all based on individual preferences. We do have evidence-based, we do have, certain things that we do, we have a format, but it has to be based on what that person wants and what that person needs. And I think that's the core of IPS. And then for our last point, so we have work incentives and benefits planning. And part of what we're trying to do is help people navigate how do you work and still receive Medicaid, SSI, SSDI, housing subsidies, or how do you start working and then come off of those benefits and be prepared for that. One of my very first clients came to me and he said, hey, I get SSDI and I decided that I don't want to get it anymore. That was a learning curve. We figured it out, but he was able to start working full time and successfully transition off of his benefits because that was his choice. And so part of it is we understand how the work impacts the benefits, what's going to happen. If you need to report income, let's talk about how to do that. If there are work incentives or things that are available to you, part of my job is to know that or to figure it out. And then also when things change, I have to keep up with the laws, or I have to at the very least know that they're coming and then kind of catch up later. So we have to know if minimum wage is going up, or if, disability income goes up, what does that mean for the limits of where we can be? Because it's not my choice to choose to have somebody stop getting benefits or not. And so it's all about individual preference and kind of making sure that people are comfortable and they understand what's going on. So all that to be said, kind of questions or comments do you have?